New tonight, a brand new emergency department is about to open in Tampa. We got a sneak peek at the new ER tonight. Bay News 9's Trevor Pettiford is on scene at Florida Hospital Tampa to tell us how this place is different than what you might be used to.
With 48 beds and 50,000 square feet of workspace, this emergency department is nearly 3 times larger than the current one. Now, nobody likes to come to an emergency room, but as you're about to see, coming to this one will be a totally different experience. From the moment you walk in, you instantly know this is like no other emergency department you've seen. Looking more like a hotel than a hospital, Emergency Department Medical Director Doc1stER says this new facility is about caring for a patient's comfort as much as the medical staff cares for their injuries.
A lot of excess noise actually makes healing harder. People get sicker, they don't do as well when there's a lot of noise and disorder. This cuts down on all of that.
The rooms are bigger, the lighting is better. There are even rooms specifically designed to treat children. But what's most advanced about this ED is how soon a patient will see a doctor. It's called Doctor First.
So when patients come in, they're going to see an emergency department, emergency physician right away when they come in. So I'll be working with a triage nurse and tech. I'll evaluate the patient, decide what they need, and then I'll put in orders right away.
Dr. Tierheimer says this can cut a patient's time in the emergency department in half, and that could be half the healing process.
When patients come to the emergency department, they didn't come here to get registered. They didn't come here to get triaged. They didn't come here to talk to 3 other people and tell them all the same story. They came here to see the physician and to get tests ordered. And so that's what we're doing.
Florida Hospital Tampa is opening its new state-of-the-art emergency room, and it comes with some big changes.
10 News reporter Danica Lawrence got a first look at the new facility and how patients can expect to be treated within seconds of stepping foot through the doors.
Along with the 48 new private rooms, they're also changing the way a patient visits the ER. You're going to see a doctor first. They also have a new decontamination process, and some of the new rooms, get this, will transport you to another place. ER stereotypes gone.
We're taking the attitude now of we don't want anybody to wait.
Florida Hospital Tampa's new $70 million emergency room facility is twice the size of its old one, and it's catering to patients' every need.
Patients want privacy.
ER Dr. Stephen Lay is looking forward to the hospital's new process called Doc1stER. It means wait times will be cut in half.
And we're going to use a lot of our senior physicians that have been doing this, and they have kind of the gut skills to evaluate patients quickly.
President and CEO Brian Adams shows off the new technology called ambient light. It turns white hospital walls into exotic and fun, sky-high places that can be out of this world for children in a stressful moment.
We know patients come to an emergency room with a high level of anxiety, and so we designed a facility that can help lower that.
If you need some emergency care in the Fletcher Avenue area of Tampa, there's a new place for you to go. Florida Hospital Tampa's new ER just opened. Here the patient sees a physician right away, and all the paperwork, insurance, and registration comes last. It's called Doc First, and it's the one-of-a-kind system in Florida. The new ER has 48 private treatment rooms with family accommodations and kid-friendly rooms with technology to help reduce their anxiety.
So you heard the question right before the break, would you ever go to the hospital emergency room if you didn't have an emergency? If you're thinking no, well, what if the hospital invited you? That's exactly what will be happening on Sunday at Florida Hospital Tampa. Starting at 10 a.m., they'll open the doors of its new emergency room and its intensive care tower for behind-the-scenes tours. New model of care is one of the terms that are being used to describe this. What exactly is that?
So we're very excited about our new state-of-the-art emergency department. We're going to have 48 treatment rooms. It doubles the size of our current emergency department. But the most exciting thing about our new emergency department is our Doc1stER, where you actually see a physician first. So before you get registered, before you get
quite
treated.
a concept. A lot of people, that's what they expect when they go to the ER, and the reality is very different. You're filling out 20 different forms. You're telling people the same story before you see a doctor. So how did this idea come about? It seems like common sense, but it's not.
Right.
It hasn't been done before.
Right. We listened to what was important to our patients, especially in an emergency. And what's important is seeing a doctor as soon as possible and getting your workup started. And so that's what we're doing.